Welcome to episode 7 of my podcast, and I would like to thank everyone that's been listening up to this point. I wasn't sure what I wanted to cover in episode 7. Um, I know that my journey has been long. In fact, it dawned on me that July is not that far away. I've got a 76th birthday coming up in May, and then July is my anniversary date for falling. So I'm coming up on 2 years of recovery. And even though I set goals, it's looking like it's going to be this fall before I'm walking to the point where I can actually not walk normally. I may still need a cane. I'm not sure what I'll need. Maybe I'll need my walker. One of the things that I did buy this week is called a rollator, which is different than a walker. It has 4 wheels and a seat and is very maneuverable. I'm improving as far as walking. I can do a circuit now around the living room and the dining room, back and forth, 40, 50, 60 steps in the walker. My gait is becoming better, but my legs are much stronger. The knees don't hurt at all. I really am amazed at the technology with knee replacement because I've got great knees. There's no pain. The knees are in great shape. My problem was my core. My core is still weak. Walking is the best way to build the core, walking and standing. So I've been standing in the kitchen instead of raising my chair up. This wheelchair, this incredible wheelchair, will actually raise me up so that I can reach into cabinets and get things. It's pretty amazing. But instead of using that feature lately, I've been just doing a stand and getting what I need. And then I've also been doing a stand at the stove, which is at one end of the kitchen. And then I walk sideways along the counter, holding on past the sink all the way to the refrigerator. It's kind of a L shape. And then back to my chair. You may remember that when I came out of Encompass Health last October, I weighed 308, and I was hoping that I was maintaining that weight. When you're as sedentary as I am in a wheelchair, food can be an issue because it can cause you to put on weight. So one of the things that my wonderful wife has done, which I shout out to her again, just so many things I can't even name that she's done for me. But this one has been great because every morning I get steel cut oats with fresh fruit from Aldi and fresh honey from professors at school and friends that have beehives. And she grinds fresh coffee beans and then puts it through a manual drip process using a filter and a carafe, which takes quite a while, but it makes an incredible cup of coffee. I've gotten back into baking bread. And even in a wheelchair, I've been able to do the whole process from making the dough and baking a beautiful artesian loaf. Good food, healthy food, plant-based, has really worked. In fact, I was able to weigh this week, and I now weigh 281, which means I've lost almost 100 pounds from when I originally fell. So that's great news. I would like to get down to like 250, 260. Even though I'm 6'7", that would be a more ideal weight for me. And I don't want to really buy new pants until I get to a weight where I know I can wear them for a length of time and not to gain weight back. But that part's really good. I like losing weight. It's definitely puts less pressure on my knees, even though they're new, and the rest of my body. It's been months since I had that knee replacement, and they're in great shape. So what's been my limiting factor after the paralysis, after the knee replacement surgery, after losing a ton of weight? What's been my limiting factor? Well, it's been my heart. And I didn't give you much detail on that, but just to give you a little background, even though they did detect AFib during my stay in the hospital after the spinal surgery, it was never followed up on. It wasn't followed up on in rehab, and it wasn't followed up on in the skilled nursing center. I don't know. Maybe I was experienced some AFib instances. There was a wonderful doctor, female doctor at the hospital with my second knee replacement surgery, and she discovered you've not only got AFib going on, but you have a low ejection factor, which means your heart's not pumping hard enough, you're in danger of a stroke. You're in danger of throwing a blood clot. So they had me wear a heart monitor. And she's the one that really jumped on this issue of the fact that my heart was not in good shape. And that was my big limiting factor. Well, as soon as I got to Encompass Health, they really jumped on it with a heart doctor who put a monitor on me, came in to see me every other day. And she got me on blood pressure medicine. She got me on blood thinners. She figured out that my limiting factor in rehab and the reason I was not able to walk very far, maybe 15 steps before I was totally exhausted. The doctor said, you've got to find a good heart doctor to follow up with this because you're not out of the woods by any means, even with, the blood pressure medicine and the blood thinners I put you on. So I was lucky enough to find a very, very good heart doctor here in Mobile. And I haven't been really naming doctors, but I'm going to name this one. His name is Dr. David Neary, N-E-R-Y. And when I first saw him, he said, I read like 200 pages over the weekend of your medical background here. And my God, you have been through the ringer. So what I want to do is I want to put a heart monitor on you again, and I want to do a baseline EKG, and I want to just go back to the very beginning and try to figure out what caused this issue with your heart and how we can get your ejection factor up and deal with the AFib issues. So that's what he did. And now I'm on a number of drugs. I'm on different meds that have absolutely blown me away because my ejection factor, which was 35 to 40, is now like 60, 65, 70. My AFib, I haven't recorded any on my Apple Watch since January, and that was only a couple of episodes. So that's improved. My ejection factor's improved. My heart rate, which was scaring everybody at 35, is now averaging 65 to 70. And during walks, I can get it up to 100, 105, 111, 120. But I think that I've done a lot and come a long way into helping my heart heal itself. I'm still working with home PT. My walking is improved. My strength is improving. My core is my weak point now because that's what I really need to build up in order to walk normally. My balance is getting better. My what's called spatial orientation is getting better, knowing where my feet are by feel and not having to look down and see where they are. So that's improving. I really am pleased with my progress. About a month and a half ago, I felt like I was plateauing and I was getting discouraged. So I pushed myself harder and got over that. And now I feel like I'm no longer plateaued and that I'm making progress. So things are looking up. I'm doing really good at this point. I'm proud of myself. I'm still wondering, what if I had gotten into Encompass Health right after my spinal surgery instead of a standard rehab facility, which, okay, it was good. They got me through the paralysis, and the skilled nursing center got me standing and walking a little bit. And so I owe them a huge debt of gratitude. They did great under the circumstances. And when I say under the circumstances, I'm talking about the constraints that they work under in our standard healthcare system. Fighting with insurance companies all the time, being able to keep people long enough. Dealing with equipment that was broken and didn't get fixed. I didn't understand that one. Dealing with equipment that was outdated, not the best, but still doing the best that they could under the circumstances. Staff turnover, staff shortages, perhaps not being paid adequately. I don't know all the inner workings of trying to keep a rehab facility up and running, especially one associated with a hospital. I don't know what it takes to keep that same group in the skilled nursing center working. But I do know that Encompass Health is dramatically different than those two organizations, the hospital-based rehab center or the skilled nursing rehab center. Why is that? Well, I've looked over all of the information about Encompass. They have like 100 plus installations around the country. They must have hundreds and hundreds of people working in these facilities, and their total focus is rehabilitation. Encompass Health deals with the total body and everything that's going on with every system. And that became very apparent when I first arrived, because it turns out that there are 100 little things that an organization can bring to the table that make your life in that facility much, much better and allow you to accomplish more and allow you to keep your spirits up, allow you to see a light at the end of the tunnel for your recovery. And it tamps down depression and upgrades encouragement and support. I really felt like I was encouraged and supported by a ton of little things that they did to take care of me. From the first day I arrived in the ambulance and they carried me in on the gurney, rolled me in, and okay, this is not like, Moe's restaurant where they go, "Welcome to Moe's." I mean, maybe somebody at corporate told them they have to say that every time the door dings and somebody walks in. Is it sincere? Maybe, maybe not. But I got to tell you, when I was rolled into Encompass Health in Pensacola, lots of people were working at their desks in a nursing station, and everybody either turned and looked, some even stood up and made eye contact with me and said, "Welcome to Encompass Health." And then they wheeled me back to a private room. And everybody just gave me big smiles as I went by. Okay, that encouraged me so much. They really welcomed me in. I didn't feel like it was something that they were told to do. I felt it was genuine. And then I got a full evaluation and orientation, including going into a conference room with other patients and getting a presentation about all the things that were available, all the things that we could expect, the names of the people that we could contact if we need anything, the organizational structure and how things were done, and also what was expected of us as patients. We were expected to respect each other and everybody else in the facility. We were expected to do the things that they asked us to do. When they came to get us for PT, we were supposed to allow them to help us into a wheelchair or whatever and go to physical therapy. When people came in to do occupational therapy, whether it was in the room or in the gym, we were expected as patients to cooperate and participate. We were also expected to eat our food so that we could keep a good level of nutrition. And they had a dietitian on board that made sure that the food was, I will say, a cut above standard hospital food. The food at Encompass was much better. I don't think they were making it like maybe in the old days when they were cooking everything on site, but it was much better. So we had dietitians. In my case, I had heart doctors. I had a urologist. I had a caseworker that overlooked everything. And I guess the best part was their electronic management system was very efficient. Everything that went into it was shared with everybody else, so that whenever another doctor came in, they had already gotten a complete update from my chart on where I was at and what my issues were. So they didn't have to ask me a bunch of background questions. We were just able to take off from that point. Now, I'll have to say, my favorite time was early in the morning when I would wake up, I would have breakfast, and sometimes even before breakfast, a doctor would come in and I'm 6'7", I guess 283 pounds now, which is good. But this doctor was about 6'5", 6'6", big guy. Apparently played football, wore a size 16 shoe like me, except he had a handshake with a hand like a catcher's mitt, and was just a wonderful doctor. And he was kind of like a hospitalist that overlooked all my care. And every morning he came in to see me and a big smile on his face, shook my hand, made sure that I was doing okay, that things were being covered. I was seeing all the right people. He was just a joy to work with. The same thing with the people that put the heart monitor on me, the same people that were urology and were dealing with my issues with having to cath, and people just looking out, making sure that my post knee replacement surgery was healing. The wound was healing. I had to then go and get the stitches out. They provided transportation all the way back to Mobile from Pensacola to my doctor to get the stitches out. They provided that transportation going back. I was cared for at a very high level, and I felt it. And I felt like if I hadn't had the constraints on my heart, they would have accomplished a lot more in 2 weeks than the other places had accomplished in some period of time longer than that. I don't know. Had they been able to keep me longer than 2 weeks, even with the heart issues, I might have made even more progress because I would have been on the heart medicine, which would have reduced the AFib and increased my ejection factor and given me more energy. Because when you have a low ejection factor, your oxygen gets depleted very quickly and your muscles just collapse. When I would do 15 steps, I would stop and I wouldn't be able to lift my foot. I feel like it was glued to the floor. I was exhausted. So my heart was my limiting factor. And if they had been able to keep me longer with the heart medicine, because the doctor, obviously the heart doctor there at Encompass would have continued to work with me. Instead, they had to send me home and I had to find my own heart doctor, and we had to kind of start from scratch. Now, I'm lucky I found a really good one, and he's helping me tremendously, and I'm very happy about that. But I wonder, had I been able to stay at Encompass on heart drugs for maybe another month, maybe longer, would I be further along now walking than I am? Because even though home PT is good, it's only 1 or 2 days a week. Encompass was every single day. And I haven't been able to go to an external physical therapy facility because I can't drive and my wife works every day. So that's not been an option for me. I've had to not only work with home PT, but I've had to take it upon myself to get better. Take it upon myself to do the work. Take it upon myself to continue to have the wherewithal to get better and work at it. But would I have been better off had I been able to stay longer at Encompass Health? Well, Medicare would not pay for it. They did not want me to walk. They did not want me to get better. They did not want me to fully recover. What they wanted, I guess, was to get me out of there as soon as possible so they wouldn't have to pay all that money. But think about it. I'm still on Medicare, and they're still paying money for everything that's going on with me at home. Would they have been better off in the long run to pay more money up front to get me further along so that I wouldn't need all this home health care? I wouldn't need to continue on with what I've had to continue on with personal doctors? Yes, I would have had to find a heart doctor to continue on, and my urologist. I would have had to do those things and, my primary care. But maybe if I'd been able to stay there longer, I would have made it further down the recovery road instead of when I was thrown onto the recovery road, looking just like the picture from my podcast at a very long road that disappears into the distance in the horizon. That in itself is discouraging. But then I had to ask myself, and I've really asked this question. Even in the 2-week time frame I was there, they did a wonderful job with me. Now, why are they so much better than a dedicated rehab unit in a hospital? I understand the skilled nursing facility. Their focus is not on rehab. It's a nice to have part of it, but it's not their focus. Their focus is, I guess, taking care of people in an environment where they're either going to go home or go into a nursing home or going into assisted living or whatever. In my case, I was going to go home, but I wanted to go home after being able to walk again, and that didn't happen. I was able to stand and walk a few steps, but it didn't deliver what the people had hoped it would deliver, and they wanted me to stay longer. They could have made more progress with me. But 3 times in our standard healthcare system, 3 times insurance companies, including Medicare, have kicked me out early. Very, very discouraging. The very state that we're in with our healthcare in this system, it sucks. When I look at what the Canadian healthcare system is like, and in the Scandinavian countries, in Europe, yeah, everybody says we can't go to socialized medicine. We can't do this, we can't do that. Well, we better damn near do something, because it's not working. What's happening is simply not working. And I'm angry. I'm angry at what I've been through, and I'm angry at what people I know have been through. I don't know how many people I could find that would have stories about how the standard healthcare systems fail them, but I dare say it would be a lot. Maybe I will be doing that down the road with this podcast, so that you're not just listening to me, you're listening to other people. Maybe, I don't know. I'm just an old guy in Mobile, Alabama. Can I get a grassroots thing going here with people that we can make some kind of difference? I don't know. Maybe not in the current situation we're in politically. Maybe we'll have to wait till later. But, I'm retired. I have a ton of time on my hands. I'm doing this podcast for a reason. And maybe my journey is to try to make some sort of impact on whoever I need to make the impact on. That we have to change the way our healthcare system works. Let's take a look at how Encompass does it. This is something that intrigued me. I don't have all the answers. I've looked on their website. I've read all the information on the web that I can about Encompass Health. The only thing I can share with you is what I personally went through. I read you in the very beginning the things from their website, what they hope to accomplish. I know they accomplished that with me, but why are they better? Well, I had a little bit of an insight from one of the home care nurses that I've become friends with. And she told me that one of the reasons that I'm unique and that she likes to come visit me is that I always have upbeat things to say. I make her laugh. I do magic tricks for her. I've been into close-up magic for years and did that in the rehab hospital that I was in. I talked to her about what was going on with me, and she said, you know what? The thing that stands out to me about you is that you want to recover. You want to do the work in order to get better. And I go, well, what? Thank you. But is there a reason that you're telling me that? And she goes, yeah, because you're encouraging. And my day, in a lot of cases, are very discouraging, because I'll get to someone's house and they don't want to do the work. Or even worse, they basically lie and say, yeah, I did all this work, but we can tell that they didn't. So the only time they actually do the work is when an OT or a PT person is there, and then they yell at us because they're not making progress. And then they go, well, the solution is you need to come more often. And we can't, because insurance is not going to pay for it. The best we can do is to arm them with the exercises and the things they need to do. And a lot of these people won't do it. And if they won't do it and I'm there getting yelled at, that's not a good experience for me. That's discouraging. But when I know that you're on my schedule and I come here, I know that you're going to show me, in your case, that, you're getting better. I can check your blood pressure, you check your vitals. I can see they're getting better. Your attitude is really good. I find out that you've lost more weight. I hear from the PT folks that your walking is getting much better and that you're doing the work. You want to get better in spite of insurance companies, in spite of failures within the standard healthcare system, in spite of the fact that you're having to work with home healthcare, maybe people coming just one day a week, and it's your responsibility the rest of the time to do the work to get better. And I thought, wow, I assumed everybody that worked with home health care or even in the facilities would do the work. But that was actually a common theme that I heard when I was in rehab, that they would go to a room to get someone, and then I would overhear someone talking. Well, they wouldn't get out of bed. They didn't want to come. And some people would come to the gym and just lackadaisically go through the motions. They wouldn't put the effort in. I mean, I had one case where I had a wonderful person, and a gentleman with OT who walked in the gym at the skilled nursing center on a Saturday and said, he was about 6'4", looked like a bodybuilder. And he said, we're going to do some arm exercises. And he handed me 2 5-pound weights. I had been working with 3-pound weights and doing okay. But he handed me 2 5-pound weights and said, I've been looking at your chart and looking at your progress. We need to push you a little bit harder here. You up for it? I go, yeah, I'm up for it. And I busted my ass with those 5-pound weights, which I bought some and I have here at home, and I still work out with them. And it was a lot heavier than 3-pound weights. In order to recover from knee replacement surgery, to make sure that I didn't get scar tissue built up, watching TV, I would put my leg up, one had the surgery at the time, my leg up on I lost the word, but the thing that sits out in front of a couch you can put your feet on. Anyway, I would put my foot up, and then I would put a 3-pound ankle weight on my knee, and I would allow that weight to push down to keep my knee pushed down so that it would be stretched so that no scar tissue would build up. I did the work, but apparently a lot of people didn't want to. And that's their failure at their feet. And even if they were encouraged by the people that were doing it, the PT and OT people, and they didn't do it, well, I don't know how you can't force people to do the work. They have to find it within themselves. But then I started thinking, okay, why is Encompass better? Why are they able to accomplish more? And then I got a little more insight from this home care nurse when she said that, because we were discussing this, she said, well, I can tell you that in these facilities, the biggest issues are staffing concerns. They have people that quit. They have people that don't come in. They are constantly dealing with staff shortages and issues. And I thought back to where I was in, rehab and the skilled nursing center. I go, you know what? I was catching wind of things like that. And, the other thing that she mentioned is they don't pay them enough to stay. They don't pay them enough to want to do a good job in a lot of cases. So I thought back when I was in Encompass, I wasn't going to ask people what they were paid, but I just got the attitude, and just discussing about their career and discussing about how long they've been there and discussing what their goals were and, their background, getting to know them and caring about them as a person. I discovered that a lot of the people have been there for years, and they felt, from a general comment, that they were well compensated, well paid for what they were doing. And I think the same thing was with the nurses. there wasn't much turnover. There wasn't much staff shortage. I was seeing the same nurses all the time. And even the nursing assistants were different. I talked before about some nursing assistants that just came in with a bad attitude, and turns out that in most places they're paid minimum wage and all they need is a high school diploma and a short education. It's not a great career. They had the same situation at Encompass Health. Maybe they're paying these people more. Maybe they're doing what they need to retain them longer, or maybe they're also giving them a pathway where they can study to become something different on that road and have a different career. I don't know. I mean, maybe at some point I'll ask Encompass Health if they're doing that. But whatever they're doing, they're treating their people so much better. And that shows through to the patients. I know when I was in the gym working out at Encompass and I just was doing something, looked around me, listened in on other people doing stuff, man, it was different. It was so encouraging. It was so high tech too. They had every machine worked. They had a device that they would strap you in and pick you up and allow you to walk around the gym. They put me in a harness at a certain point and they lifted me up with this machine, and they actually lifted me up off the ground. And so I thought, wow, this is cool. I'm flying. And then I thought, wait, I'm defying gravity. So I went back and I learned the words to that part of Defying Gravity, the song from Wicked. And I talked to my PT lady and said, would you guys work together with me and we'll do a little production with me raised up in the air and singing Defying Gravity? They thought this was a great idea. So we worked together to get me in the harness. The lady working the computer was laughing, lifted me up in the air a few feet off the floor, and I started waving my feet and arms and singing as loud as I could, Defying Gravity. Everybody in this gym stopped what they were doing and froze and then started laughing. And you can hear the laughter in the background. And then they brought me back down to earth. It only lasted for under a minute. And the whole time I was there after that, people kept commenting to me about how much they enjoyed that and how much, I brought a bit of levity to the whole situation, and that it was funny. And I'm constantly looking for the humorous or the funny things that have happened to me in this thing. And, whether it's making goofy jokes about, being on a bike and burning fat, or whether it's, not wanting to do sit-ups and push-ups. I don't do ups. I mean, it's just finding those little bits and pieces that you can fit in to try to get people to laugh. And sometimes you make an absurd statement. You take something to the extreme. You put yourself in a harness and sing Defying Gravity. You do what you can. I do magic tricks. I did magic tricks for people in addition to humor. I just tried to brighten that day. In fact, one of the nursing assistants, I actually taught her how to do one of the magic tricks so that she could do it for her 9-year-old. And one of the PT folks who had a 10-year-old, I showed her how I did a particular trick so that she could teach that to her son. And yeah, I'm not really adept at close-up magic by any means, but the little bit I can do, I thoroughly enjoy, and I think people enjoy. So I've used that. I've used humor as best I can, even if it can be a little stupid at times. I'll take that chance. If I can get a reaction from people and get a laugh. The other thing I did, in addition to, magic tricks and goofy things to get people to laugh, is I tried to take an interest in other people's lives. The people that were taking care of me, I would ask them about their lives. Were they married? Did they have children? What was their background? How long had they been working, especially at an Encompass Health? The people there uh, I really became kind of close to because they all took such good care of me. And it was a mutual feeling that both of us were working toward getting me better. So, what does Encompass Health do that is different than the standard healthcare system? Well, I think in both systems, whether you're talking the standard healthcare or a dedicated rehabilitation hospital like Encompass Health, it boils down to the people. Yes, the equipment is great, the state of the art things at Encompass that help them. That's all good. The electronic medical management system that's totally integrated into their system so that everybody's kept up to date on the current situation with every patient. The dedication of the people in that facility was just exceptional. And I'm wondering, how does Encompass Health replicate that across hundreds of installations across the US? I just have experience with the one in Pensacola, Florida. I'm assuming that everything is done pretty much the same across all locations. And if that's the case, then Encompass Health is a big organization that's doing a lot of good things. But I will have to say, I didn't know about them. Now, maybe it's because I don't live in Florida. Maybe because I'm in Mobile, Alabama. But I did not know about Encompass Health. I just let the standard healthcare system take me in and do whatever it was going to do with me. And again, it wasn't terrible. They did help me recover from the paralysis. They did help me at the skilled nursing center, help me stand and at least take a few steps in a walker. But in both cases, insurance kicked me out too early. Now, they kicked me out too early at Encompass Health. So the insurance industry is cutting across all of these organizations, even ones like Encompass Health that are trying to do a better job with their patients. Why was I any different than the average patient that walked through the door and got treatment? Well, maybe my attitude, my desire to get better and recover helped me interact with them in such a way that it helped their system work better. In other words, the cooperation that I offered, together with the people that accepted and appreciated that cooperation, helped us both accomplish a set of goals that continue to move forward and help me recover. And I'm going to stand by this statement. If I had only been able to stay there longer and continue that process, I firmly believe I would be further along right now than sitting at home trying to do everything on my own, even with the help of the great people that are in the home health care organization. They're great, but they only see me one time a week right now. At the most, and when I got home, it was 3 times a week. Then it went to 2 times a week because of insurance, and now it's 1 time a week. I think it's at a certain point, they're just going to no longer pay for it, and I'm going to totally be on my own. Will I be able to recover and continue moving forward? Yes, I will. I have that determination. But it's discouraging for me to realize that there was this organization out there, this facility that was really great, really helping me a lot. And I couldn't stay. I couldn't stay because of a system that we have in place that has, over the years, turned over more control to the insurance companies so that they can deny treatment for whatever reason they want or can find in order to save money and generate more profits for their shareholders. I guess that's what's happening. I don't know. Um, actually, I kind of do know. I've read up a lot. I've read a lot about this situation that we're in, and the insurance companies employ doctors and other medical folks that take the phone calls from these facilities and they read my medical notes and they determine whether or not I can stay longer. So it depends on the person that you get on the phone when you're making the call. It depends on the person's qualifications and whether or not they had a good day or a bad day. I don't know. Maybe their determination was based on the fact that they were exhausted or the fact that they just wanted to get it done and get it over with. I'm not saying they're bad people. I'm just saying that the way the system is set up, it doesn't encourage a patient being able to stay longer if the goal of the insurance company is to get them out as quickly as possible. That alone is discouraging, and I really feel like Encompass Health is doing some great things across the country. And I wonder if this is a common factor that they have to deal with. You know, in my case, I think I had good reasons for being able to stay longer. I had exceeded all of the things that they had asked me to do at Encompass. And the grading system they used determined that I was working hard and I was accomplishing a lot, but there was a lot more I could have accomplished. Instead, it backfired on me. Maybe because I was working so hard and I'd passed a lot of the tests, they said, well, he's done. He's done everything. He needs to go home. And that's just not the right way of thinking. It's not the right way of seeing progress from a patient who's willing to put in the work. If you're willing to put in the work and you're making the progress and you're exceeding the goals, then allow Encompass Health to set a higher goal and then continue with the program for a certain amount of time to reach that goal and maybe continue on until I could have possibly walked out of Encompass Health and gotten into the car with my wife instead of having to do it from a wheelchair. Perhaps their system, which works so well, if it hadn't been short-circuited by the lack of insurance paying for it, and I should mention here, I'm not a wealthy person. I couldn't pick up those costs myself. I had to let insurance handle it or walk away. Well, not walk away, I guess roll away would be a better way of putting it. I had to roll away from Encompass Health because insurance would no longer cover me. And I could not pick up those costs, which are very, very high. I understand that. I don't know what to do about those high costs. I don't know that they're not legitimate. Maybe they are, maybe they're not. I see. It seems that the high cost of healthcare is something that without insurance, people simply can't get. And I've been lucky. I've been covered by a very good insurance policy through my wife's work until I could no longer use it because it wouldn't pay for the senior nursing facility. And I had to switch to Medicare Part A and Part B and the Medicare Medigap policy, which I was able to do, and that's covering a lot, and I'm thankful for that. But again, if Medicare or whatever insurance company would just look at the situation differently and say, wait a minute, this patient could reach a point in their recovery where our long-term costs would be lower because we are paying for directed care in a facility that is accelerating their recovery so that perhaps we will save more money in the long run if their goal is to save money. I don't know. All I know is when I look at what Encompass Health did for me, I am astounded at the progress I made in just 2 weeks, just 2 weeks with them. So I'm going to end this episode by saying I'm very thankful for everyone, every person that's helped me along this road, whether it was in the standard healthcare system or Encompass Health. Again, it boils down to the people. And I had some really good people along the way that cared. And the constraints put on them by the system is not their fault. They are still dedicated. They still worked hard with me. In some cases, we had a really good time together, and I made some good friends. And that is even continuing while I'm working here at home with the folks from my home healthcare. I've become good friends with several of them, and they've done their best. So I'll end this episode by saying I'm encouraged by what I'm able to do. I'm dedicated to my recovery now. And I want you to know that if you get in a situation where you're unclear about what kind of help you can get, and it involves rehab, remember to talk to the folks at Encompass Health wherever you happen to be. They have hundreds of locations across the country. Make sure they're on your list to talk to, because if you get referrals from your doctor and you're able to go into their program early enough, you might get out sooner than you would in the standard healthcare system. I guarantee you will have a whole body approach to care that is different from the let's just fix what's wrong with you and get you out the door attitude that you will encounter in a lot of standard healthcare facilities. So with that, I will say thank you again for listening to my podcast. I very much appreciate it. And I will try to make the next one even more interesting, even better. We'll see. Thanks again.